Hi, how are you today? Here I am again. Don't forget to subscribe to my channel, okay? Don't forget to subscribe on it because you're gonna be getting more of my videos and a lot of other content is about to come. Here I am gonna talk to you about denture problems. If you wear your denture right now, soon you might have a slightly problems or little problems or major problems. Who knows? This is the nature of a denture. Even if you're losing weight right now, your denture gonna feel loose. If you gain too much weight, also your denture gonna get too tight. So it fluctuates. So I have listed a few of most common denture issues. Like I mentioned at this moment, the denture is loose. You hear a lot of people about the denture being loose. It has to do with so many things. Starting with the impression, didn't have a suction when it was taken. Sometimes the impression didn't capture the main areas in the mouth. Also has to do with if the denture is overextended. The overextension is like denture is too high all around. It's too high, so the technician more likely leave it too high, which is interfering with the denture to kind of get that suction that it needs. Also, another one that I listed is open bite. People sometimes when they close their jaw together, there is a open bite like this. If you ever had that experience happening to you with your denture coming out of the office, dental office, don't leave until they fix it, until they find the way to fix it, because it could be many things. More likely, the easiest way to fix is to remake it. If you open bite severe like that, just have them redo it for you. Have them redo it. There is no other way other than grinding every single tooth out in order to have that denture to close. Another issue that I have listed is my teeth are too big. You hear so many people complaining about their teeth. Oh, my teeth are so big, it's huge. Many of them. But it has to do when you wax trying. You are supposed to check all those things in your wax trying. If your teeth you don't like your teeth, just say, I don't like it. It's just too big. That's not me. So you can get those adjusted, change in a wax trying. Once the denture is done, you can't change any type of teeth. You have to get it on a wax trying. So sometimes the technician go by the person look. If you get to see them, most technicians, we followed sometimes all the orders on a prescription. But if your teeth are too big, sometimes go because the arch, it's hard to kind of predict how the denture gonna look like onto the wax trying. So those are the main things that a person has to be aware of, how you're gonna look like when the first time that trying is in your mouth. So you need to say something. Another thing is my denture's too bulky. Too bulky. My mouth's too huge. I can't close my mouth, and it has to do sometimes with technician leave too much thickness on it. The thickness should be only like a quarter size, or even less than that. If you get a quarter and see it, it should be about that size all over. I try to do it lesser, like a little bit thinner, because when I'm finishing my dentures, I kind of imagine and put in my shoe, somebody else's shoe, and imagine this is me, this denture is going into my mouth, and how I would like to feel it. So I try to imagine that I'm be the one who gonna wear that denture, so that way I can kind of finish it in a way that make the patient comfortable. So another complaint, I can't wear, it's too sharp. It's too sharp, too pokey. So it has to do also with the finishing part of it. Probably the technician leave the bubbles inside or around the borders. So it's a poor polish. It's a poor finishing. If the patient cannot wear his denture, it's the poor finishing. You have to make sure everything is really, really smooth like a baby. Another denture problem I see, my teeth fall out. My teeth fall out. They just come out right away. The bonding. That happens a lot with cold cure, affordable dentures, or a lot of those cold cure dentures, just there is no way to retain the teeth for over 3 or 4 months. It has to do with the bonding agent that they used to put it on, or that they didn't kind of grind on the teeth. That's why more likely the teeth doesn't bond without those bonding agent. So another problem, I don't see any smile. So most likely, if you're not seeing a smile, it also has to do with the wax try-on that you didn't actually kind of notice, that you had to mention that you like to see more smile. That has to do with the vertical dimension, and it has to be increased in order for you to see a smile, and sometimes with the teeth size also has to do. Anyway, it's all for today. Thank you for watching. Don't forget to subscribe to my channel. Have a good day.